Well, hey everybody, it's Sandy and welcome back to my channel dedicated to helping you advocate for your own health one topic at a time. Well, guys, today I want to talk about priority with vaccines. So which population should be the priority? I think we've heard a lot about this lately, but I've recently read an article that just turns everything else that I've read totally on its head. I find it fascinating and I hope you will too. So I wish I had read about this concept like 48 hours earlier than I did, because I might have included it in a video I just did about my thoughts on the vaccines in general, and particularly the two messenger RNA vaccines that are coming out, the Pfizer and the Moderna. I'm going to link that video that I recently did right here. While this might have fit in that video, I think it makes a decent follow-up. So I think we've all heard that we're not going to have limitless supplies of vaccines as soon as they hit the market, and we're going to have to prioritize as a society. Now, there was a committee formed, a committee of the National Academies of Sciences, Engineering, and Medicine at the behest of the CDC, and this committee proposed what they call an equitable way to allocate vaccines. And it's pretty much what you would think. It's the first responders, and then the healthcare workers, and then the elderly, and perhaps the most vulnerable. Now, this concept is pretty much echoed in the advisory group to the World Health Organization, which also recommends focus on essential workers, healthcare workers, and the vulnerable, although they also have something about people in urban populations, so that's a little bit different than the committee that advises the CDC. But overall, the WHO and the CDC are kind of saying the same thing here. Well, there's a growing voice of people who have some pretty impressive credentials after their names that are saying that this is all wrong. And what the critics of these recommendations say is that the problem with this model is that it focuses on only using the vaccine to inoculate an individual, as opposed to using a vaccine in order to reduce transmission in society. So the critics to the traditional approach of determining how to prioritize who gets vaccinated say is that it's more important to take the most beneficial route, not the most obvious route. And what they say is best is to target super spreaders. Now, there are people who weighed in on this who are physicians, there are people who are physicists, epidemiologists. It's a pretty impressive group. I'm going to link some things down below in the description box, but I didn't find only one person saying this. One of the most persuasive statements that I read was by the faculty of Johns Hopkins University and the University of Southern California. Now, what they've said in their letter to the CDC is that they disagree with the concept of focusing on vulnerable and elderly, and instead they think it's more important to focus on super spreaders. They argue that even the elderly and even the vulnerable will in fact be better protected if we focus on super spreaders and getting them vaccinated. Guys, once I saw it read, it seemed so obvious that this seems right to me. And by the way, I don't know about you guys, but after the last 8 months and listening to what I listened to come out of the World Health Organization and the CDC, frankly, if somebody is outwardly disagreeing with them and publishing statements saying so, I'm listening. So the people who are proponents of this theory cite a couple of things. First of all, it's just basic math. Super spreaders shut down universities, they threaten whole communities, shut down schools in our communities, they can shut down businesses. It's just a way to really do some heavy hitting with a vaccine would be to target these potential super spreaders. They also say that it's important to learn some lessons from previous pandemics or epidemics. So in 2009, we had the H1N1 epidemic. And at that time, states were allocated certain amounts of vaccines based on their own populations. And at that time, the priority was the elderly and the vulnerable. But what they say is that later studies showed that even the elderly and the more vulnerable would have been better off if we had used the vaccines at the time to stop the rapid spreading. So if we had gotten to the younger people who are more mobile and out in society. So in their words, they said, the lesson from previous pandemics is vaccinating likely asymptomatic spreaders early on to avert multiple infections in others. Guys, I find this fascinating. I don't know, maybe this is just my inner nerd coming out, but I think this turns everything we've been thinking on its head. And after I got to thinking about this, and I really let it digest. I really thought about it for a while. I found myself feeling really optimistic, because if we can just be really smart about how we use these vaccines as we get them, I think that we will reap tremendous benefit instead of like doing the same old things that maybe didn't work ideally in other pandemics. I mean, nobody's asking me, but I'm certainly glad that people who seem to know what they're talking about, and at a minimum, people who will start the discussion are willing to come out and publish statements. I hope that that rises to the level that it should and that it gets discussed so that they use some really good modeling. Does anybody else remember the word modeling from several months ago? I don't remember it fondly. So I think one of the reasons that they're saying that this could be particularly important with COVID is because COVID has such a high percentage of silent or asymptomatic super spreaders. In fact, what they say is that 10% of the people who are infected are doing about 80% of the infecting. So it's really a very small proportion of the people who are infected with COVID that do most of the infecting of other people. Now, in addition to that, they say up to 40% of the people who are infected are completely asymptomatic. So those people are at high risk of being the super spreaders, because if you're asymptomatic, you don't know you're sick, you're not going to go get a test, you're not going to change anything you're doing, you're still going to get together, you're still going to go to work, whatever it is. Now, of course, we should all be following CDC guidelines, and we should do things that we can, like put some social distance there, wear masks. I mean, we've all talked about that. But certainly if you were infected with COVID, if you knew you were infected with COVID and you had any kind of social conscience at all, you would stay home and isolate. But if you are silent, you're asymptomatic, you're not going to know that. So if you are in a position to be a super spreader, that is a recipe for disaster. The fact that there are so many asymptomatic infected people with COVID, and the fact that so much of this disease is spread by the very few super spreaders is, I think, really calling for a different approach. And I just take my hat off to the people who sat around and thought about this and just turned this whole approach on its head and said maybe something completely the opposite of what we were thinking might be better. So in this new upside down model being proposed that I think is so fascinating, they don't argue with the concept that we should have our healthcare workers and our first responders a priority. But after that, focusing on super spreaders changes the model so that we're not really looking at it as a way to inoculate just individuals. Of course, it is one, but we're really looking at how to stop the spread in society. Another way to look at it is it's a focus on prioritizing the driving of the transmission as opposed to the infecting of individuals. Now, another thing that I read along these lines is that this approach suggests that locations might be a really good way to focus and prioritize. So one of the indictments of contact tracing when somebody is infected is that it's only as reliable as the person who's communicating it. So people forget things, people omit things accidentally or on purpose. But if instead you focus on locations, you have the opportunity to pick up a lot more potential spreaders. So the proponents of this new prioritizing of super spreaders say that focus on locations is more effective than random vaccinations, and at least as good as trying to identify super spreading individuals. So the way this looks is they compiled a scoring system, and it divides people into classes. Now, I'm not going to delineate what each class is, but just as an example, a class 1 individual is somebody who's pretty much staying home. Maybe they're just going to a store. They live in an area where people are following the guidelines. Maybe they have contact with at most 5 people. This would be a low-risk individual in terms of their ability to spread infection. And then they go all the way up to class 6. Now, class 6 is somebody who has visited highly public places, like somebody who's in airports, for example. These are people who have had contact with more than 100 people maybe on a given day. And these are the people who have the opportunity to become super spreaders. So when I think about this, I'm thinking of places like they said, airports. I'm also thinking universities, schools, all kinds of places like that where you have the potential of having an event that can just shut down many people and infect many people all at one time. I'm wondering if this feels like an aha moment for most people like it does for me. I hope that this will at least enter the debate at the highest levels so that whether it gets decided that we're going to try to do it this way or not, I want to be able to feel comfortable that it actually got debated and we got to the right answer, or the people that know a whole lot better than I do get to the right answer. But I'm really happy to see a fresh perspective injected in there. I think we're all a little bit cynical at this point of the WHO and the CDC. Not that they're wrong, and I know that they were on a learning curve like the rest of us, but I just like seeing some fresh ideas, especially when they're supported with good modeling and math, and something that just says, let's take a departure from what, has worked like only marginally well up until now. Now, I do see one potentially huge issue here in the United States. We are a very large country. We just can't seem to be nimble. One of the drawbacks of being such a large country is just that. I wonder how this is going to look, because we don't have like some smaller, more nimble countries, first of all, a national healthcare system where everybody's in a database. Not everybody in our population wants to be vaccinated. So I'm not really sure how this will look. I wonder if universities are going to require the vaccination to come to class, if certain schools are going to. I envision that being a fight. If we think masks were a fight, just wait until we ask some people to become vaccinated. I think the same argument applies, however, but I do think there are going to be some challenges with that, and I would anticipate that the best bet is going to be that they start a really aggressive public service type campaign so they can get a buy-in. I think if there's anything that I've learned from this past several months, especially when it comes to masks, is it's just more important to get people to buy in. Telling people what to do isn't a good way to win them over. Now, some people will do what they're told, and in a matter of a public health crisis, I think that's actually better than being so ruggedly independent that you just will defy all good sense. And I think that's been the case with masks largely. But I always think it's better to get people to buy in. And I think that if people understand and it doesn't get viewed as something that's so controversial in the first place, if it doesn't have an opportunity to become controversial, if that's even possible in our country anymore, I think that's better. So I would envision that this will look more like a public service campaign to get people on board with this. I don't really feel very confident that it's possible to get all the super spreaders vaccinated. In the end of the day, I think that even if we adopt this model, it's going to be some sort of a hybrid where we have to just recognize that a certain subset of the population is not going to want to get vaccinated. They're not going to do it. And therefore, we will have to use the vaccine also as a means to give protection to an individual and not only as a means to prevent transmission. Let me know what you guys think about this. I honestly, I just was so fascinated with this concept, and I just feel so optimistic that there are people thinking about these things and how to make really good use of our short supply at this time, at least until we get more. So I hope that this was helpful. I hope that it's good food for thought. And if you guys have questions about it or you have strong feelings about it, I really recommend that you talk to not only practitioners in your area, but write to your local elected officials. At a minimum, it might help to bring this discussion to be more public. You'd like to see this get hashed out. I can't think of a better way than to get your local elected officials talking with people who have some expertise. So let me know if you like this. Let me know if it was helpful and if it got you thinking about anything and how you feel about it. And until next time, be well. Bye-bye.